So let's talk about the liver and what are the functions of the liver. So the liver ensures the smooth flow of qi, and the liver stores blood. Now let's look at the other functions of the liver. So the third one is that it controls the sinews. So what does this mean? Every organ, every Zang Fu organ, particularly the Zang organs, have a thing that it controls. And what does that mean? It means if there's a problem with that area, we should look to the liver not nourishing it. And we already know that the liver does two things in terms of nourishing it. Might be blood, not nourishing the sinews, or is there stagnation of qi that could affect the sinews? So what it means is that the function of the liver, that wood aspect of functionality, affects the sinews. Sinews is also a word for tendons. So when you have a piece of meat, or like firstly let's think of a muscle. It is a piece of meat. Kind of going like that, and then you've got the two ends of it that attach one. So muscles have to attach to two different bones or aspects of the bone. So the point of a muscle is to articulate the joints of our body, hold our skeletal system in place. And so the ends of that muscle is made of tendon. Now tendinous material, or sinew material, is much more fibrous than a muscle. Now if you've ever eaten a piece of meat, I'm sorry for the vegetarians that are watching this. I used to be a vegetarian. I probably would have been grossed out by this analogy, but that's gritty, sort of difficult to chew part of meat. Now if you the white parts of meat is like the same material that tendons are kind of made out of, that sinewy kind of thicker parts of the steak or the meat that you're eating. So in our body, what happens is, as we age, we tend to get drier, we dry out, and that in a Zang Fu sense, that could relate to liver blood deficiency, liver blood not nourishing the sinews, not nourishing the tendons. It could be because of sweating. So sweat and blood are related, because when you sweat, you're losing fluid. Blood is also a fluid, and so rather than getting into too much more detail about that, but you're losing this fluid, and you're losing the yang of your body through there's a bit of yang that's lost through sweating. So you're losing that ability of your body to maintain its moisture, and it dries out. And so therefore your muscles, and when your muscles are stiff, it's actually the tendons that are the issue more than the muscle itself. If a muscle goes into a cramp, that would be more related to the spleen, because the spleen controls the muscles. So we'll talk about that afterwards. But also muscle cramps can be related to the liver aspect of the qi stagnation. So liver qi not flowing smoothly could lead to muscle cramp. So what we're getting at in Chinese medicine is that the muscle health relies on the smooth flow of qi, and it relies on a good quality liver blood. So if you have a patient that comes in with joint problems or pain or cramps in the muscle, or like stiffness in their joints particularly, and like they might say, oh, like my fingers feel so stiff, or my ankles particularly, your Achilles tendon is a big one that gets stiff, and very can feel very fibrous. And particularly if you're a practitioner that does a lot of palpation, you kind of can notice this on some patients. You feel that their muscles feel really fibrous, and that's one of the benefits that you get as being an acupuncturist versus if you're just being a herbalist. You're really just palpating their pulse, and maybe palpating their abdomen or something like that, but you're not sort of, when you're doing acupuncture, you're much more likely to palpate different areas of their body, just even if it's just before as part of the treatment, part of the procedure of putting the needles in their body. So you're a bit more aware of these kinds of things. But if you come across a patient that's very sinewy, like the sinews are kind of standing out, then that might be because of dryness, right? So dehydration, and that's can be relating to blood deficiency, or basically wood lacking the nourishment of water. So water moisturizing wood to help it be flexible and not break, whereas bending and snapping might be the analogy that comes to mind if you see someone that's very stiff in their joints. Yeah, another aspect of the sinews, but the liver controlling the sinews, might also relate to its ability the liver's affinity to wind. Correlation of the liver to sinews can be in rigidity and contraction, like that. So when a muscle contracts, it's because the sinews kind of are causing that contraction. And in Chinese medicine, the liver is related to wind. So in the 19 lines, it says everything relating to wind. Basically, wind and wood are synonymous with each other. So that's like a fundamental correlation between those two things. So like wood is wind and wind is wood in that way. And so when you have a convulsion or a contraction, like some kinds of, like also in the 19 lines, it relates sudden illness to wind and wood. So that could relate to this kind of aspect of contracting of sinews relating to wind and wood and the liver. So the other one that is that in a TCM sense, it manifests in the nails. So if you look at your own nails, so healthy nails shows a health of liver blood, and it's more liver blood, to be clear, than liver qi in the nails. So the nails are like an extension of bone, and bone relates to the kidney, and the nails are like the wood's bone, if you like the wood's manifestation of blood on the outside of the body. So what will we look for in the nails to look for liver blood? So if you had a patient that, I've had some patients that have mentioned their nails to me. They said, oh, I've noticed my nails easily chip. They get these little white dots in them. They get ridges in them. So they actually have like little lines going this way, kind of horizontal lines in them, vertical lines, sorry, in them. Or you can have horizontal little flecks of white in the nails. Or in generally, like a good example would be to look at a person who's a smoker. Okay, so their nails tend to be very yellow and dry. Part of that is because they're touching the cigarette all the time with the nicotine, like the nicotine staining their hand. But that, on another aspect, the withered and the cracked nails and that inability of nails to heal properly, or people that get infections in nails all the time. So it doesn't have to be the hands, it can be the nails on the toes. You need blood to properly heal your body. So if you constantly get areas that don't heal very well, like sores that don't heal, infections that don't heal, that kind of stuff, or skin diseases and things like that, that can often relate to a blood deficiency problem. And that, again, could relate to the nails on the feet. So ingrown toenails even could be seen as a lack of the liver, basically we would say wood isn't able to flourish because it flourishes in the nails. So healthy wood, healthy liver blood means healthy nails. I guess something to also consider as a practitioner, like if you're a new student, is if you do notice someone with terrible nails, then maybe they use a lot of acrylics, or they're in a job where they're externally, like the smoker, they're externally touching something that's affecting them in that level, and that may also be exacerbating the problem, or giving you and there's an external reason for that, the nails to look like that. The next one is it opens into the eye. So the eyes in Chinese medicine relate to liver blood again. So the ability to see means you need blood to be able to, you need blood to nourish the eyes, you need blood to have proper vision. Now there's a few things in Chinese medicine that we consider that Western medicine probably wouldn't consider so much. So yes, if you had spots in your eyes, floaters in your eyes, or you had a difficulty, like you hit your sight deteriorated. This is all just Chinese medicine theory, so I'm not talking to people, if a patient suddenly had sight deterioration, you wouldn't just stick with Chinese medicine. This could be a red flag for other things as well. So I don't want to have to keep mentioning that on this channel, but particularly in this series, this is theoretical knowledge of Chinese medicine, not kind of replacement for Western medicine or something like that. So if a patient came in to me and said, oh, I can't see, and this morning my eyesight suddenly deteriorated, they'd be getting in an ambulance to a hospital. because and they probably wouldn't be coming in and seeing you. Doesn't mean that Chinese medicine can't help them, but that could be a serious brain problem. You know, lots of things could be wrong, and it's not so much Chinese medicine's place, I guess, to intervene at that point. What you have to understand as a student of Chinese medicine is all these really, really serious illnesses, so ranging from lifestyle complaints where, you know, people don't feel great, they don't feel good energy, or they feel stressed or something like that, things that are just trivial or insignificant kind of things, right through to massive severe health problems, heart attack, you know, tumours, that kind of stuff, severe health problems. Like Chinese medicine, the theory of it, the knowledge of it encompasses all of that stuff. So there's things where, like in classical texts, you'll see them talk about how to treat this thing, or how when a patient presents like this, and we know now with modern technology, like, okay, that person could have a brain tumour if they suddenly lost sight. But in Chinese medicine, we can understand it from, okay, they must have had some kind of sudden deterioration of blood. Why did that happen? It could be like lots of different other explanations, but it still helps us to understand how to understand it. And there's some things where Chinese medicine can very easily understand it, but it's probably not the greatest at treating it. It might take a long time to treat something. Whereas with Western medicine, you go in and do surgery, and that could be resolved much more quicker. Then there's some things where Chinese medicine's a lot quicker at resolving something than Western medicine, like common cold, for instance. There's no treatment for common cold in Western medicine. There's plenty of herbal formulas for common cold, whereas if you get it straight away, you can have a much better result than if you took nothing at all. So anyway, like, let's just talk about the eye. So opening to the eye means you need liver blood to manifest good sight. Now, one thing that Chinese medicine observes that Western medicine doesn't really acknowledge so much is just this idea of not clear vision, like as in a person that just feels their vision's dull. There's nothing wrong with their eyes. They might have even gone to an optometrist and had a test and said, well, their eyesight's fine. But the patient might complain, I just don't feel as clear, I don't feel that clarity. But sometimes it can also be this mental fog, right? So they feel like a cloudy headedness, they feel a foggy headedness. Not always, but often I find these patients feel really good after acupuncture. Like as a sense organ, so the liver has a connection to the sense organ of the eye, and this can relate to like I was saying, the dull vision or the dim vision, not seeing clearly, or just like not. It doesn't have to be a problem with vision. Go back. So the vision aspect of the eyes is could be like an actual like a person that has nearsighted, farsightedness or something like that, where they need to wear glasses, and that could relate to a liver blood deficiency issue. But it can also relate to people that just have an inability to they feel like they can't see clearly. Now, so this can often be like after acupuncture, people feel a sense of clarity, like they feel clear. And this is, so I've had patients like this where they've expressed this symptom. They've said, oh, after acupuncture, I feel so much more clearer. I can think clearer. I feel like I can see clearer, that kind of stuff. So there's this aspect to our vision in terms of like in a mental health sense. If you think about vision, right, it's like your ability to see your life, see yourself in your life. So it could have this crossover effect in terms of if someone doesn't sleep very well, let's say, so therefore they get blood deficient, or it affects the quality of their liver blood. They don't have a sense of clarity of their self and their vision for their life and their sense of purpose. And we'll get to the other mental functions that it kind of relates to. But also a symptom of liver blood deficiency is floaters in the eyes. So this is where people will see little blobs or spots. So if you've ever squinted at the sun and then you've come away seeing little blobs, or had a bright light shine in your eyes and you can then see little blobs floating around, that's what floaters are. But someone's not shone a light in your eye, you just see little blobs in the air. A common symptom in migraines is what they call the prodromal symptoms of a migraine, which is these like flashes, or some people do get squiggles or like visual disturbances. It's just usually classed as. So like if you're staring at a computer screen, you sometimes see the lines become very squiggly or something like that. Like I don't know if you've remember having an old computer, and the older screens used to do that, like the square shaped monitors, and you'd sort of almost strizzling lines and stuff like that on there. So any of these kinds of things can relate to the liver. Now, something to remember as a student of Chinese medicine is that it's not, so when you start making a diagnosis, you're looking for a pattern of disharmony. Sometimes you only need one or two symptoms to give that diagnosis of a pattern, but sometimes there can be symptoms where they can relate to many, many things. And it's not like when I teach my students, I call it like a hang your hat symptom, like there's only one or two things that could relate to, or it's definitely a symptom related to that. So it's just something to bear in mind with, and your actual teacher should be able to kind of help guide you, or especially when you get to the clinical situation where you're looking at treating patients and you have these symptoms, you think, well, what do I do with these symptoms? How much weight do I put on these symptoms? Which ones are really, do I not so much ignore, but which ones do I really, really pay, close attention to? So opening into the eye, and so this can relate to like the ability of blood to nourish the eyes in that way. And then again, you can kind of see the 5-element process of water nourishing wood. And so if you need, like, a lot of problems in the eye relate to like not enough fluid in the eye to nourish the eye. And so you can get even things like in a TCM pattern called liver yin deficiency is dryness in the eye. One of the main symptoms is like dry, gritty eyes. So not so much blurry vision or floaters in the eyes, that's definitely a blood deficiency symptom, but that dryness, that dry, gritty eyes, not enough fluid to moisten the eyes, can relate to liver yin, or that's like a liver fluid of the liver deficiency. Okay, and then finally we could talk about houses the ethereal soul. Well, what the hell is that, Marie? It sounds a bit weird. So in TCM we have these they're called like the mental emotional aspects of our body, let's say, are broken up into different things, and they certainly have an affinity to different aspects of our body. So the ethereal soul, or the hun, is paired with its other soul, the po, or the corporeal soul, and there's a couple of fundamental differences about these two things that we kind of understand. So your ethereal soul, or your hun, one is it's very much related to dreaming, and dreaming so let's just talk about dreaming in one sense. So a person who's fully rests at night shouldn't have a lot of dreams. They shouldn't have very many dreams, or they should very rarely dream. And it's a very interesting thing to kind of think about dreams, because in a psychological sense, so if you went to a psychologist and you said, oh, I have this dream, or like for a regular person to be kind of aware of a dream or be bugged by a dream, that can happen in a healthy person, let's say, because your mind, in Chinese medicine, your shen, is trying to make you aware of something, and a psychologist would help you interpret that dream. And this is away from Chinese medicine, but there'd be varying things that could mean. But essentially it's your subconscious trying to tell you something. It's trying to reach out to you. That's what a psychologist would think of that. And so in a healthy person, we shouldn't be bombarded by dreams or have regular dreams. And so if we are, it's a sign that our shen can't rest properly, our mind can't rest properly. When we get to talking about the heart, we'll talk about the shen, and we'll talk about that more. So if you can sort of click on that video, if I haven't made that one yet, then you'll just have to wait till it's made. But there's the shen, or the heart, is relating to so the shen relates to the heart, so we'll talk about that in that sense. But the hun itself does relate to the dreaming aspect, and it also relates to these very vivid, like nightmarish kind of dreams. And so if people are plagued by those kind of dreams, in one sense it can be a bit of like liver qi stagnating, not enough free flow, and that generating some heat, or that yang of your body becoming harassing your mind and making your mind not able to rest, like literally like heating it and making it really vivid and active at night. And so then you're getting these really crazy dreams. And And so let's talk about the ethereal soul here. So like, I guess without getting into too much detail, I'm not going to go into a great deal of detail on this because this is probably where we could go down a bit of a rabbit hole. And this video's already gone longer than I thought it would go. So one aspect of the corporeal soul is that it relates to our sense of purpose and our life planning and direction. So that's something that I've mentioned on this channel before. And so a person who's got strong liver blood has a place for that ethereal soul to kind of rest, or in Chinese medicine they say rooted in the liver. And I know that don't let's not make crazy jokes on this channel as I get crass. But if the hun is like rooted in the liver, it means it's got a place to go, right? So it's like if you were homeless, or you had a situation where you were discombobulated from your home. And you couldn't go home, you couldn't go to your place of residence, or you didn't feel like you had a place to go. There's nowhere for you to rest. At some point you have to go home, you have to go to your place of rest, you have to go to that place where you feel comfortable, you should feel a sense of security there. And your mental, emotional functions go to those organs at night to rest. That's what they should be doing. So if you're having crazy dreams and like really vivid dreams and things like that, on one hand it's saying that the hun has no place to rest. It's got no place to kind of, reside. And this is where I love like thinking about psychology and Chinese medicine at the same time. Like it just completely makes sense, because if someone's say having a repetitive vivid dream, in a Chinese medicine sense, we'd say, well, your hun has no place to rest. Maybe they have liver blood deficiency. In a Chinese medicine, practitioner might nourish liver blood. That means that the hun then has a place to rest, and then they feel better, and they stop having those crazy dreams. In a psychological sense, that might be your mind is saying, hey, you need to pay attention to this aspect of your life. You're not doing that. And if they start doing that, then the crazy dreams might stop, right? And so it's interconnected with this sense of purpose, and like if you're not fulfilling your life purpose, if you're not doing what you're supposed to be doing, or you're not feeling a creative joy out of life, so maybe your mind is having those crazy dreams to tell you to do that, to tell you to say, hey, get a hold of yourself and go and do what you're supposed to be doing, or pay attention to this aspect you're meant to pay attention to that. Or sometimes with crazy dreams, they can be, things that you've done in the past. People have the interpretation of dreams is really, I think, an area of psychology that doesn't come much into Chinese medicine. I mean, there are some things. I mean, if you've got that Giovanni textbook, he'll kind of go through, if you're dreaming of fires, it means this and this and that. And that's where this kind of comes into it. So there's a few things we need to think of. One is it houses the hun, the ethereal soul. That relates to dreams, and it also relates to the need of liver blood to create a place for that hun to rest. So if a person goes through a period of physical difficulty in their body, like let's say they lost a lot of blood and that's how they became blood deficient, they had a miscarriage, or they had a very traumatic birth, or just even having a birth with difficulty breastfeeding and maybe some mental health stuff after that, like postpartum depression can be common, or things like that, and they got blood deficient and their body's like trying to recover and trying to get back to where it was, then it makes sense that because of that blood deficiency, the ethereal soul doesn't have a place to rest, and so therefore it's not nourished by blood at night, and then they lose that sense of purpose. If you've got that sense of purpose, you can probably endure a lot more hardship in life, in mental stuff, right? So as a business person, I can endure a lot more difficulty if I know it's for a greater good, let's say. Whereas if it's just like, oh, what's the hell is this point for? I don't want to do this anymore. This is why a lot of people, I guess I see a lot of small business owners endure a lot of hardship and difficulty, more so than an average Joe in their business, in their job, because they're like, well, I don't care. It's not my business. I don't really care about it. It's not my purpose. I'm just here to get money. Whereas if a business person goes through hardship, they'll go for years and years without getting paid to keep running their business, because there's a sense of purpose in that. And so they will endure all this hardship and difficulty for like what they perceive as a greater good, or because it's their purpose. So what I'm getting at is it's intrinsically linked. So sometimes we can be going about life and we can just kind of lose our sense of purpose. Well, that could be related to a physical thing that's happened, which Western medicine doesn't see that correlation there. They just think, well, okay, we treat this mental health disorder with some drugs or with some cognitive therapy or something like that. But sometimes there can be that physical imbalance, and if we don't address that, we'll just come back again, or the drugs won't fully fix it, and you'll end up with another detriment, or something else will happen, you know, as well. So that's one thing, okay, and then the other one is the liver controls planning, and that's also related to the Hui. So in Giovanni, he says this is ideas derived from chapter 8 of the Simple Questions, the Su Wen. The liver is said to impart to us the capacity to plan our life smoothly and wisely. And a disharmony can result in a lack of our ability to plan and a lack of life direction. And I think that so on one hand, if people have a very strong sense of purpose and a life direction, so if you ask them, you know, what do you see yourself doing in 5 years or 10 years or 20 years, and they can articulate that easily and quickly, and they're just like, bang, this is what I want to do, this is where I'm going, then they would have a strong sense of purpose for their life. So we would say they've got a strong, you know, their liver must be strong, and they must have a place for their liver blood to be, their hun must be nourished by liver blood. And likewise, if you're dealing with a patient who's going through a turmoil like that and they're just a bit disillusioned, and they suddenly have lost that sense of purpose, I would look at liver blood and say, is your liver blood strong, and what's going on there, to see if they have that sense of purpose and planning and stuff like that. And yeah, so that's, I mean, treating these things is a whole nother aspect, and that's we're not going to cover that in this video, but that would be they're the main things that the liver kind of does in a Chinese medicine sense. So we've said it stores blood, it ensures the smooth flow of qi, it controls the sinews, it manifests in the nails, it opens into the eyes, and it houses the ethereal soul, the hun. So I hope this video has been good, and if it has and you're interested in knowing more, make sure you subscribe to the channel. Tell your friends about it. If you've got friends in TCM school and they're interested in knowing about Chinese medicine more, that's what this series is all about. And so thank you so much for joining me on this video, and we'll be doing the heart and the fire element relating to heart in the next video. So thank you so much for watching. I look forward to seeing you again on the next video.